As a pathologist, what I love about my job is I can look at every aspect of that patient's laboratory specimens, and without meeting the patient, I can tell so much about their disease. And I like to, when I'm looking at a patient's specimen, come up with the most complete picture for the clinician to look at.
Pathology really is the study of cancer and disease. It's a communication or a crosstalk between the surgeons and the internal medicine doctors on what they're dealing with. When it comes to oncology specifically, pathology plays a role both before, during, and after the surgery. We really are guiding the surgeon on what type of surgery he should do, how extensive he should do the surgery, or maybe even skip surgery altogether because chemotherapy may be better. And so our role before is to set up the treatment plan. During the surgery, we have a very important role where we can tell the surgeon what the tumor is at the time of frozen section if not known before. We can tell the margins, we can tell if they've got all the tumor or not. Then afterwards, we tell them if they were successful in that surgery and how aggressive the tumor will be based on all the additional studies we're doing.
It's a very coordinated effort, and the key is that all of the patient's care team is in a room at one time so that a very solid and effective plan is made so they can get the best and most effective treatment they can. When I first got here to First Health, we only had one tumor conference that was combined for everything. And now it's 4 conferences so that we can specify. We have a focus now on breast cancer. Dr. Jante, that's his area of expertise. We have another pathologist here who has an expertise in cardiothoracic pathology, and so that's a separate conference as well. And then my area of expertise is gynecologic oncology, so that's women's cancers. And on the horizon, we'll be looking at adding gastrointestinal conferences as well, so that we can provide care in this corner of the state where there's not necessarily a lot of places nearby or that are easily accessible for patients.
I think the best part about having a comprehensive cancer center come here is that it will allow us to add more of the breakthrough and the cutting edge research coming in, new treatments coming in. It'll allow more access to that here locally as opposed to sending them hours away. And I think you're also getting the benefit of having the community medicine that we have where the clinician can just call us at any time. The surgeons can pick up the phone and talk to the exact pathologist who's looking at it. That intimacy is not lost, but you're gaining that advent of having the academic side of medicine come into your local community. And so that cancer center with here really allows us to maintain the intimacy that we already have, but add that academic advantage to community medicine here.
When you get the diagnosis of cancer, you're looking at a lot of visits, and as much as you can make each visit an efficient process for that patient, that's just an amazing thing. Because what becomes more important to them when they have cancer is their time with the things and people they love, not being at the hospital. So that cancer center will allow coordinated clinic visits and infusion visits and so on. They go to one place, which is super duper important. I think the other big impact we'll have to the community as a cancer center is providing complex cancer care right at home. We're over an hour away, if you go north, south, east, west, from the closest cancer centers. And so this is an area where we were lacking with that resource. For a lot of patients, if you're getting daily therapy, it's really nice to be able to do it close to home. I think this is a really special and unique corner of the state where we can do a lot of good for the community here. And I'm hoping if we have the cancer center and then we can grow as a more comprehensive laboratory, then we can truly provide a comprehensive laboratory care for the community.
I think it will give us a larger footprint for pathology.
Right.
It'll allow us to have more specialists in all different areas in one building. And you really can't underplay how the value of having more specialists in one building, mostly because our field is actually getting more complex.
Right.
It's not getting easier.
Yeah.
We're having more tests, more molecular tests, more aspects of tumors that we've never really discovered before. And they're all coming now into play into treatment. And that cancer center needs to be there for us really to grow into where we're going into the future. future with
Right.
medicine. So the impact that a cancer center will have cannot be understated.